Have you ever looked in the mirror and felt like your own skin was a stranger? What if every inch of your body felt like it didn't belong to you? Trapped under layers of thick, dry, scaly skin that cracked every time you moved. This isn't a horror story. This is real. This is ichthyosis, a rare, lifelong skin condition that quietly haunts thousands of people around the world. And most of us have never even heard of it. Some call it the fish scale disease, but that name barely scratches the surface. Because ichthyosis isn't just about dry skin. It's about pain, isolation, stares from strangers, and the endless battle to feel normal. Today, we're diving deep into a condition that dermatologists study, but most people ignore. A disease that affects not just the body, but the mind, the spirit, and the way you move through life. So stay with us as we uncover the top 10 truths about ichthyosis that no one talks about, but everyone needs to know. Meet Sarah. She was born with skin so thick and cracked that doctors initially thought it was a severe burn. Her parents were terrified. Turns out, it wasn't an injury. It was genetic ichthyosis. For years, Sarah couldn't play outside in the sun, couldn't wear certain clothes, and every night she would spend hours soaking in tubs, applying ointments, just to feel somewhat comfortable in her own skin. She's not alone. 1. Ichthyosis isn't one disease. It's over 20. Most people think it's just one skin condition. In reality, there are more than 20 types of ichthyosis, each with different causes, severities, and symptoms. The most common? Ichthyosis vulgaris. It affects 1 in every 250 people. But some forms, like Harlequin ichthyosis, are extremely rare and severe. 2. It's often genetic, but not always. About 95% of ichthyosis cases are inherited, meaning you're born with it. But in some rare cases, it's acquired later in life, usually due to underlying conditions like cancer, kidney disease, or HIV. So if scaly skin appears suddenly as an adult, don't ignore it, get checked. 3. It's not contagious, but it can be isolating. One of the biggest myths is that ichthyosis spreads. It doesn't. You can't catch it. But people with ichthyosis often experience bullying, social anxiety, or even depression, just from the stares and whispers. Ever been judged for something you can't control? Imagine living like that every day. The skin can crack deeply. The thick, dry skin can crack so deeply that it bleeds. These cracks can become entry points for bacteria, increasing the risk of serious infections. People with ichthyosis must constantly moisturize up to 5 times a day just to avoid pain and stay safe. 5. Heat is the enemy. Unlike most people who love summer, patients with ichthyosis dread the heat. Why? Because they don't sweat properly. That's right, many can't regulate their body temperature and are at risk for overheating or even heat stroke. So while others enjoy the beach, they may be stuck indoors, watching life pass by. 6. There's no cure, but there is hope. Let's be clear, ichthyosis is incurable, but with the right care, it's manageable. Creams with urea, lactic acid, or retinoids can reduce scaling. Daily baths with exfoliants can help remove dead skin. And yes, dermatologists and researchers are working on better treatments every day. 7. It can affect more than just the skin. Some types of ichthyosis also impact the eyes, ears, and internal organs. Buildup of skin can cause hearing loss, blurred vision, or difficulty breathing in severe cases. This is more than skin deep. It's a full body condition. 8. Mental health matters too. Let's not sugarcoat it. Living with ichthyosis can be emotionally exhausting. Anxiety, low self-esteem, isolation, and sadly, Many doctors treat the symptoms, but not the emotional scars. We need to do better. 9. Children suffer most. Kids with ichthyosis face more than physical pain. They endure name-calling, exclusion from sports, and even school refusal. Early education, both for parents and classmates, is critical in building empathy and support. 10. Support changes everything. One of the most powerful forces for people with ichthyosis: community. Support groups, online forums, and rare disease organizations offer hope, connection, and guidance. No one should have to fight this battle alone. Always consult a dermatologist if you notice unusual skin dryness, scaling, or discomfort. Self-diagnosing can delay treatment and worsen symptoms. Only a qualified medical professional can provide accurate diagnosis and care. Behind every flake of skin is a story. A child learning to smile through pain. A teen finding courage to wear short sleeves. An adult discovering strength in their scars. If you or someone you love is living with ichthyosis, know this: you're not alone, and your skin doesn't define you. Let's break the stigma. Let's raise awareness. And let's support those living with rare conditions, because knowledge leads to empathy, and empathy leads to change. If this video taught you something new, hit that like button. Have you ever heard of ichthyosis before, or know someone who has it? Share your story in the comments. And don't forget to subscribe for more deep dives into health topics that matter, but don't get talked about enough. Thank you for watching. Take care of your skin and your soul.